Let me give you an example. In my hometown of Oakland, California, and I'm really proud of Oakland, Get Screened Oakland, Marsha Martin, Mayor Ron Dellums, we've taken the lead in making sure that our community organizations are funded, that testing is a priority, that all of the initiatives that we all know so well work, we're beginning to do in Oakland. We had to declare a state of emergency in Alameda County in 1999 as it relates to the African American community. We tried then to declare a state of emergency in Washington, D.C. at the national level, but we couldn't quite get there. So I think it's about time that we do that and that we call for a national AIDS strategy and a national AIDS plan. That's what we need to do.
Yeah.
And so I know that when I return to the United States tomorrow, I will be talking with my colleagues in Congress like I do after each International AIDS Conference. Speaker Pelosi, members of the Congressional Black Caucus, Progressive Caucus, Hispanic Caucus. I'm going to talk to all of my colleagues about how we strategize so we can address our own epidemic in a way that it deserves to be addressed. And that is, how do we begin to put together a domestic PEPFAR? Because that is what we need. That is what that's exactly what we need. That's what the Black AIDS Institute is calling for. So we have a few opportunities, though, for action on some matters before we adjourn in September. Chairman Waxman, who's been a leader in so many efforts in terms of oversight and health care, he's going to hold a hearing on the new CDC incidence numbers in the Oversight and Government Reform Committee in early September. The Congressional Black Caucus's annual legislative conference, that will take place at the end of September. And in our annual HIV and AIDS Brain Trust, which I chair with Congresswoman Christensen, we will be talking about the impact of AIDS on the African American community. We need to explore what opportunities are available right now to provide increased funding to the CDC, which is severely underfunded. You need that $1.3, $1.4 billion just to get started. I mean, that's just to get started. So we're going to talk about what we need to do and what we need to mount to begin a real prevention mission. So that's going to be discussed as soon as we return. Quite frankly, this is long overdue. You know, some of the ongoing flaws of PEPFAR, let me just say, provide us with certain lessons that we need to translate to our own response to AIDS in America. First, let me just say, we need to develop a single AIDS strategy. Secondly, let me just say it's shameful that 27 years into this global epidemic that we don't have a national strategy. We don't have one. Like PEPFAR, such a strategy must orient our domestic AIDS response towards achieving clear and ambitious objectives, and I mean ambitious objectives, in terms of reducing HIV infection rates, increasing access to care, and reducing racial and ethnic disparities. And we must insist on universal health care. We can't forget that's part of our struggle in America. Universal health care. A PEPFAR for the United States should build stronger partnerships between communities and our public health service agencies. It should include a commitment to rebuild our healthcare system and infrastructure in our country. And so those are part of the components that we must look at. And we all have to make a commitment to eliminate that federal ban on funding needle exchange programs. That needs to go. That needs to go. And our own domestic PEPFAR must include comprehensive sex education for our young people. Comprehensive. 70% of young people infected now are African American teenagers. 65% are newborn babies, African American newborns. My bill, I hope you know it, H.R. 1653, the Responsible Education About Life Act, it's Be For Real. That would repeal the abstinence-only policy of our own country and provide for comprehensive sex education. We did that in PEPFAR this year. We got rid of that 33% earmark. People told us we couldn't do it, and I said, yes, we can. We did it. We did it. And so we're going to have to commit to doing that on our own, in our own country, in our own domestic PEPFAR. So let me just say thank you again for being here. Thank you for the work that you do each and every day, because we never would be at this point with PEPFAR, the Global Fund, our Orphans and Vulnerable Children's initiatives, CDC, our Minority AIDS initiatives, our testing initiatives. This is, you know, it's almost, the stars are almost lined up. They're aligned now, you know, and we've got to use this moment. It is a defining moment to pressure our own government, to pressure the Congress and the next president, and of course you know who I am supporting as the next president, you know. To insist and make sure that we develop our national AIDS strategy and plan and move forward and stamp HIV and AIDS from the face of the earth. Thank you again, and let me now